There it is. Alex McKenzie. So good to have you on the line. How's everything, my friend?
Good, my friend. Just enjoying the last of my days off before heading back to work, but you know how it is.
Absolutely. We've been looking at all of the photos that you've been sending to the Wolfpack support, and we're definitely jealous. You were up around 42 degrees centigrade, I hear.
Yeah, it was just a cool day by our standards, but yeah, we survived and managed to get home after shift and have a beer before heading to bed, so that was good.
In true Wolfpack form. Fantastic. That's so good. And for those of us who are listening in, can you tell us where on the planet you're joining us, Alex?
So I'm based in Adelaide, Australia, which is obviously central southern part of the country. So it gets quite hot around this time of year. The service I work for probably covers, well, it does cover the whole state, and it's a mix of, in the rural, remote areas, as volunteer and paid crew, and in the central city area, it's mostly paid professional paramedics, if you want to call it that.
That sounds amazing. And you are in the capital city of Adelaide.
Yep, capital city of South Australia. So if you're familiar with the way the country is laid out, 7 states and territories, we're in South Australia, Adelaide, down the bottom, the middle of the state, on the ocean, I guess.
Absolutely.
To some extent. Yeah,
and then,
nice place.
And then
very Mediterranean.
Love it. And New South Wales is sort of in the eastern direction, and Victoria is sort of west?
Yep, we border Victoria and to some extent New South Wales at the top part of the state, and they're on the eastern side of us. And on the western side, we have Western Australia, which the capital of that state is Perth.
Perth.
A lot of
Absolutely.
desert between us and Perth, though.
Fair enough. I've encountered, or I should say the first major encounter I had with Australians was in Bali, and they mostly were coming from Perth. But we'll save that story for another day.
Yeah, well, the last thing Australians want to do when they're on holiday is run into other Australians, particularly Australians that are going or have been through Bali. But we'll keep that for a cultural nuanced story another time.
So the second time I had a large encounter with Australians, in fact, was this past June in Chicago at the SMAC conference, where I had the incredible fortune and pleasure of running into a contingent of pre-hospital care providers who were quite brazenly bannered with EMS Wolfpack gear, paraphernalia, business cards, and a plan for success. So just fill us in and take us back to SMAC 2015 in Chicago, and just sort of paint the picture, and if you wouldn't mind, introduce us to some of the characters in our story.
Sure. Going back before the actual conference, there was a couple of us that were discussing our travel plans and trying to work out what we were going to do, how we were going to get our accommodation, all those sorts of logistics. And it turned into a bit of a group chat using a Facebook chat group. And it sort of de-evolved to some extent. De-evolved. It went the opposite way of anything constructive before it got purposeful, but it just seemed fitting that we'd call ourselves the Wolfpack. But it was sort of missing something. It didn't identify us as a group, we thought, so we just chucked on the front EMS and kind of just worked. Can't really explain that part of it any better, but it allowed us to, I guess, get all our travel plans together. And then gradually, as we went through the piece, we started realising that there were a number of other people within the pre-hospital and EMS community that were also attending the conference, just through networks and associations through various people. And it sort of built up into getting a meetup organised on one of the evenings of the conference without us really even trying, and people offering to help and get things off the ground. Some of us were organising the logistics in the restaurant that we booked and the bar. Others were organising flyers or tickets, so to speak, business cards, whatever you want to call them, just to tell people to come down and get amongst it. I guess once we actually got on the ground in Chicago, it became a bit of a a thing, and we felt like we needed to get some T-shirts, and that sort of happened. And by the time the actual event that we organised, the meetup, came around, it had transcended us as a group of 4 or 5 people and turned into one of the best nights that I've had in a very long time, just chatting, chewing the fat, talking shop with people, and just meeting the awesome people that we get or come across on our Twitter discussions and
absolutely
and whatnot. And it's created a bit of a legacy and a friendship and a support group that we otherwise wouldn't have had.
Absolutely. And community is something that we definitely like to talk about in the EMS world. Yeah. There's no job like ours responding in the pre-hospital space, and there's all sorts of stressors that are associated with it, and challenging cases, and any number of wrinkles in medical care that it's amazing to have the support of a group that is just willing and able to bounce around so many incredible ideas and help you form differential diagnoses. That's interesting. I didn't realize that it had such humble beginnings as a support group on Facebook to try and arrange travel plans.
Yeah, it was something simple. From small thing, big things, little things grow. There's a song, Australian singer that's from little things, big things grow. I think that's what it is.
From little things, big things grow. That is logically intact. So
I think it was a bit of fun at first, and now I think we're trying to make it into something constructive that I guess everyone can benefit from. We've continued the conversations with the people in the different parts of the world. We've got people in Canada, we've got people in the UK, obviously in the United States, Australia, always looking for more. It'd be cool to get someone from Asia on board.
Absolutely.
And contributing, but sort of grown from that. We're on the verge of getting our website together, which we hope the whole EMS community can make a contribution to, and not just be the same people week in, week out.
That sounds amazing. And we're definitely going to talk a little bit more about the website, because I think it would be fantastic to put out a call for foam material. I think what's very interesting in the pre-hospital space is within emergency medicine and critical care over the past 2 to 3 years, we've seen a remarkable proliferation of foam content in terms of blogs and podcasts and all sorts of social media to help take education to the next level and add a focus or an element of evidence-based medicine. But in terms of the pre-hospital space, EMS providers across the world are really just starting to come online and find that rich network and community. So I'm so excited for the future of the Wolfpack. Alex, would you do me the favor and tell us a little bit about some of your partners in crime, some of the other original members of the Wolfpack and the support group, and where do they practice and what are their roles?
Joining me in South Australia, we have the instigator of a lot of the mayhem, which is Nick Williams. He's based in rural South Australia in a town called Port Augusta.
And that's at Kablamo Nick, correct?
Yeah, Kablamo Nick. Kablam. I better check. I need a fact check here.
All right, we're gonna link everything up in the show notes. No problem there. But
yeah, so he's Port Augusta, South Australia, which is about a 4-hour drive by road from me in Adelaide. We've got Mitch. He's based in Ardlethan, I think that's how you say it, which is a rural outpost of New South Wales. Mm-hmm. It's probably actually closer to the South Australian border than it is to Sydney. Don't quote me on that. I might have to get a map up whilst I'm talking. We've got Hayden Drake. He's based in Auckland, New Zealand. He's a paramedic Kiwi at Paramedic Kiwi. A
gentleman and a scholar.
Yeah, he is. He's a very good bloke and very learned and knowledgeable about a multitude of different things. Certainly one of the people that I look to for a bit of inspiration and guidance on a lot of different clinical matters. He's a very astute and competent clinician. So one of the people we'd probably lean on a bit when we need that aspect of support. We've got Brody in Queensland. I think he's just out of Brisbane. You've sort of putting me on the spot here.
Absolutely.
And Brody's changed his Twitter handle a couple of times in the last couple of months, so I'm not quite up to date. I might, as we're going through, just check on them all. We've got Matt Simpson, who's based in Leeton, New South Wales, not far from Mitch, but far enough that they probably don't run into each other. I guess you've got to get a sense of the geographics and scale of Australia. There's a lot of distance between towns.
Absolutely. And young Matt just was a recipient of an award in Australia too, right?
He was Young Health Leader of the Year for New South Wales, which is a pretty prestigious and big honour given there haven't been too many people out of the paramedic and pre-hospital environment to win an award like that. It generally goes to doctors, nurses, and possibly allied health, so to speak. But it's a massive coup for him, and one that we're just rapt to see him actually achieve.
What an incredible recognition, yeah. Big kudos to Matt.
So we've got Mitch, we've got myself, we've got Nick, we've got Hayden, we've got Matt, we've got Brody. We had a den mother, Jess, EMS junkie. She was sort of the one that coordinated and helped us keep things in line during the conference. But she's been doing her own thing for a little while now. She still keeps in touch regularly. She's, I think, putting more of her efforts into the SMAC conference itself and being part of the student aspects of that. But she's still certainly an important part of foundations of what everything was. She was a part of the conversations and the logistics and the organisation. So she certainly deserves a mention as well. I'm hoping I haven't forgotten anyone, but I think that is the core group.
Absolutely, and the crew is expanding rapidly.
Rapidly expanding. We've gone from, I guess, a handful of people up to, I think at last count in a group chat we've got through a Twitter account, we've got 15 to 17 people, as I said, based in the UK, Canada, US, Australia, and it is growing day by day, which is awesome.
It's really exciting to be a part of this group chat because it's a remarkable resource. I remember one day, one of our paramedics in New York City, Shlomo Winkler, had a hypotensive patient who was post-ROSC, right. And he only had a vial of dopamine. It wasn't a premixed vial, and the patient was hypotensive, and he was really trying to prevent him from rearresting. To his credit, in a calm fashion, he queried the group and said, "Hey guys, I have a dopamine vial. This is the concentration. I need to make an infusion. How should I do it?" And I would honestly say within 90 seconds, we had reference material, photos from textbooks, a step-by-step instruction guide. It could not have gone over smoother for the support in our group or for the patient, who had an excellent outcome. I followed up with him later. So that was really incredible. And can you talk a little bit about the types of conversations that we have in the Wolfpack support group?
Well, there's probably really good conversations like that one that Slow-Mo's had. There's obviously other conversations that we probably can't talk about on a podcast, but that's for another day. But generally speaking, it becomes a bit of a, like you said, a support group. When we're down, we can just hit up the group and just throw some ideas and thoughts around and see what the consensus would be. If it was a clinical problem like Slow-Mo had, a couple of minutes to seconds is all you need on a turnaround to get an adequate solution for things. But that day-to-day discussion about talking shop, it may not be limited to clinical problems. It may not be the human factors that are obviously quite prevalent in our industry and area of expertise. It's just one of those things that people don't have readily access to within their own real world lives, that has allowed myself particularly to remain a bit more buoyant about what we're doing and the job that we actually do in reality, if that makes sense.
Yeah, that's inspirational. And if I'm understanding you correctly, you're laying the groundwork for something that will continue to grow and get even larger. So can you talk to us a little bit about the future of the blog for the EMS Wolfpack? And
Sure.
Also, I think it was born in travel to conference, and one of the core missions is to support academic travel and exploring other systems, other municipalities, other areas that may do something different than you do. So talk to us a little bit about the future of the Wolfpack.
Yeah, so you touched on the travel aspects of things, and I think it was sort of a way that we could, create a virtual network that if people wanted to go and explore another system or another service or organisation that we might have a way of getting those people in there without having to go through the usual administrative processes. Obviously, that still has to be all ticked off and approved, but it always makes the path easier when you have an ally on the ground, so to speak, to achieve all that. So that was one area that we wanted to really push. I'm not sure what the plan to manage that is, but I guess just by having the continued discussions with people in the different areas, the different parts of the world, that will just probably naturally evolve. And whether that comes from a Twitter chat or a actual discussion board or something like that, we're not entirely sure, but that's sort of something that would be watch this space in the short term. But if I'd advise anyone that does want to travel to any of the countries or organisations that we may have mentioned, just hit up the Twitter account, and I'm sure you're going to get a few responses quite quickly.
Absolutely. We're very open to hosting travel, and we've had several visitors, including you and your fiance, Najri, come through New York City, which was an incredible pleasure for all of us.
Yeah,
so we like that.
It was awesome, and I have to say that I now feel that I have friends in every part of the world, so that has been probably one of the most, humbling, but, gratifying parts of everything, is that we now have, somewhere to catch up for a coffee or a drink or whatever, and someone to show you around the town that you wouldn't otherwise get. So having been back to New York, or been to New York for the first time and back to the United States twice in a year, it's been amazing to catch up with people and reconnect, because that's what it's all about.
I would love to start an internal pool, a betting pool, to see how long it'll take to have Wolfpack members on all 7 continents. I think that's our challenge there, to get somebody to Antarctica.
Well, I won't be going to Antarctica, that's for sure. It's a little bit cold for me, but maybe that's what you're working towards with all this mind over body thing.
Yeah, we're working on the consciousness training and cold therapy.
Yeah,
an interesting experiment.
The second part to your question was relating to the evolution of the website and the contribution to foam. Now, I guess we didn't set out with the specific objective to actually grow foam or foam ed or foam EMS as such. Like we were talking about before, the initial objective was to bring people together and create a community, but I think within that, everyone's going to bring a certain level of expertise to a number of different topics, whether they be the actual clinical aspects, whether they be those human factors, so the psychological, the emotional, or the what would you do sort of situations, or this is what my service does, what are your thoughts on this, could we be better, can we do this better, those sorts of conversations. And I think once we actually get a framework or a structure of the initial website, it won't be constrained by a fixed formula like some other blogs or websites can be. They tend to carve out their own niche and are quite successful for that. But I think the advantage we have is that we are a community first, and within that community we have a range of people that can offer a multitude of different benefiting topics, as opposed to we're just going to talk about the clinical stuff from here. This is all we want to focus on. So it's a work in progress. As I said, we're still just ironing out the actual layout and the design of the website, but we've got a couple of contributions ready to launch as soon as that's all done, and we're hoping to get that out into the world sometime in the next couple of weeks. Don't hold me to it, but it's almost there, so watch this space.
That's very exciting. And sort of the concept of foam is to have this broad network and broad base. And really, as EMS providers all across the planet start to come online, there are so many hundreds of thousands of voices to add to the torrent of foam. So I'm really excited to see what contributions people have and what areas of specialty people are developing, and the diversity of opinion and thoughts that the Wolfpack website will bring to our specialty.
And certainly, I guess so far, it's certainly highlighted the, although we all provide pre-hospital or EMS or paramedic care, just the nuances between the nations are dramatic. Like, the way we do things in Australia is vastly different to the way things are done in the United States, and even Canada to the United States is vastly different again. I think Australia aligns more with Canada, but even having said that, what we do versus what they do in Canada is different again. So that's actually, are there things that we can be doing better from Australia's point of view that they might be doing well in Canada, or could Australia and Canada learn lessons from the United States? And they're the types of discussions that I guess we're also having, which is it's really cool. And yeah, it just shows that although we are all the same, the diversity that exists within that as well is pretty incredible.
Some of those conversations are so interesting, and we categorize them by like call type. So your dyspneic patients or your chest pain patients, we've noticed that the protocols, even between different services on the same continent, can have so much variety. I'm wondering if within our community we could start a program called Foam My EMS Protocol, where we could describe a different type of chief complaint and pose it on the website and have people in real time add their evidence-based protocols or interventions, cite the articles, and build a best practice EMS protocol book based on foam.
Yeah, that would actually not be such a bad idea. I like that.
It seems like we're doing it in a micro scale now, but with the appropriate infrastructure and support, we could start a program, Foam My International EMS Protocol.
It sounds like it might be a Reddit for protocols.
Yeah, absolutely. That would be really cool. Awesome. So, Alex, we would love to be respectful of your time. Tell us, how can folks who are hearing about the Wolfpack for the first time connect with you?
Yeah, I think the best way to start would be through our Twitter account, which is at EMS Wolfpack, all one word. Just do it in the search bar at the top of your Twitter account. That was probably the best way to do it. If you want to follow some of the conversations, the hashtag is exactly the same at hashtag EMS Wolfpack. Generally, people that are traveling, that they want to connect their photos related to EMS providers or something they've seen in another country, they just tag those photos or thoughts about what they're seeing. The website will be up at emswolfpack.com, which is there's a parking page up there at the moment, so people can bookmark the page for future or add it to their Feedly accounts. But that's where we're at the moment, and I'm sure once you get a sense of things, you'll see that there'll be a range of people having discussions under those hashtags and banners, which you can then get in and have conversations with directly yourself. And more of it, we say.
That's fantastic. And for folks who are looking for help with travel accommodations, is that Facebook group still active, or is there a way to connect for folks online?
Should have mentioned, we have the Facebook page up online. It's been a little bit inactive because I guess most of the ready, fast conversations are happening through Twitter. But we probably will structure the Facebook group, which is EMS Wolfpack on Facebook, which people can use a bit like a posting notice board type thing if they want to get involved with that. It doesn't have too many likes or followers just yet, but that's partly probably our fault for focusing our attention in other areas. But they will work in duality once everything's up and running.
If you build it, they will come, Alex McKenzie.
He is hoping. Because it's awesome. It's changed my life so far.
Amazing. Alex, what have we not yet asked you that you would like to tell or inform EMS Nation?
One question I did have, because I'm not readily accessible to the United States media. A question, something I also want to talk about. Perhaps moving forward into the year, talking about SMAC and who's going to that. I haven't actually signed off on me being there, but a couple of the other guys have definitely booked their tickets and booked their conference attendees. And I guess the other initiatives we'd be supporting conference-wise would be the EMS gathering, which is happening the week before SMAC in Dublin. It's happening in Kerry, which is a county of Ireland, not too far from Dublin itself. We've got the Paramedics Australasia International Conference happening in November 2016 in Auckland, which anyone from the Northern Hemisphere wants to escape the winter, it'll be summertime in Auckland. Get down and check that out. If you guys want to get in touch or get involved, just hit us up through Twitter or send us a direct message or what have you, and we'd love to hear from you.
Amazing. Thanks so much for the time, Alex. Really appreciate it.
No problem, buddy. Speak soon.
Cheers.